Hi, I'm Dr. Sandy Baird, owner of Riverstone Chiropractic here in Oakland, California, and we're going to be talking about ankle sprains today. So a lot of people will come in and they are actually very surprised that I can do anything to help them recover from their ankle sprain. The old adage used to be if you sprain your ankle, you roll your ankle, you put some ice on it, you elevate it up on a bed, and you just wait until it heals up. But there's actually a lot you can do about an ankle sprain. So let's look at the anatomy of the ankle and get a picture of what's happening when you twist your ankle. The most common type of ankle sprain is an inversion sprain, and that's when the bottom of the foot rolls inward in relation to the lower leg. When this happens, the ligaments on the lateral side of the ankle become damaged. Those ligaments, there's three of them. There's the anterior and the posterior talofibular ligament, and there's the calcaneofibular ligament. So we'll look at a picture of the anatomy. It basically means ligaments connecting the bones of the foot to the bone in the lower leg, the fibula that's on the outside of the leg. Ankle sprains are graded on a scale of 1 to 3. So 1 would be a mild ankle sprain. You just tear a couple of fibers in one of the ligaments. 2 is a moderate ankle sprain. You tear part of a ligament. And 3 is a very severe ankle sprain. Grade 3, you typically need to have surgery or at least be evaluated for surgery. But grade 1 and 2 ankle sprain can be managed by chiropractic care. Did you know that the number one cause of ankle sprains is actually history of a previous ankle sprain? Other causes of ankle sprain include jumping and landing funny, tripping over some rocks or roots when you're doing trail running, slipping, falling off a curb, and any other just strange injuries. You can fall off a bike and twist your ankle. So there's a few things we need to do if there's an ankle sprain. We need to check and see if the talus or the calcaneus has become fixated. Oftentimes the muscles along the outside of the leg, the peroneal muscles, they will actually pull a bone into what's called subluxation. So that's basically pulling the bone into a position that it's not supposed to be in, and it actually gets fixated. Adhesions form right around the joint, and so all of a sudden the bones in the foot do not move as well. There's 26 bones in the foot, and the ones that are most commonly involved with the ankle sprain are going to be the talus and the calcaneus, but there could be subluxation of any of the bones. So a chiropractor needs to check everything, adjust what needs to be adjusted. The next thing is soft tissue work. So anytime the peroneal muscles are overworked or overused, they are going to develop these adhesions in them. So this happens with an ankle sprain, this happens with overuse, really any overworking condition. So you need to reduce the adhesions. So you either do that with active release techniques, you do it with Graston techniques. There's a couple other techniques that you can do, but you have to get the adhesions out. Ice, stretching, it's not going to reduce the adhesion. You really actually need to go and get the physical adhesion out of there. The next thing is to get the swelling out. So like I said, the old adage was just to elevate your leg and then let the swelling drain out that way. There's actually some things we can do that are quicker, they're more effective. So there's a certain protocol for kinesiotaping where it's actually taping for lymph drainage. It's basically getting the fluid out of the ankle and getting it to go back up into the leg, which returns it to the lymph channels that get the fluid out of the body, or out of the inflamed area, that is. So there's the getting the inflammation out, there's the addressing the adhesions, addressing the fixation. And once we've addressed those things and the ankle is starting to be more stable, we're going to start some rehabilitation exercises. So it's going to be mostly focusing on the peroneal muscles, the ones that have actually become overworked. Get those strong by using, it's going to be either bands or some light weight. So we'll be addressing the peroneal muscles, we'll be looking at the deep calf muscles, and anything else that has become weak or overworked in this ankle sprain. So a lot of times there's contributing factors. There actually could be a weakness happening in the hip or the glute that caused the person to sprain the ankle in the first place. So we look at all that and prescribe rehabilitation exercises to strengthen all the areas involved. So if you've suffered an ankle sprain or if you have any questions about ankle injuries or any other sporting injuries, please give us a call, 510-465-2342, or you can check out our website, riverstonechiropractic.com. Thanks for watching.